It went awesome. We got in there 6-7 minutes early and talked to the aide and pretty much gave him a bunch of information that he already had some of it, but reiterating about how vastly underreported this is, and that for each person that's of the 170 people that's reported to Health Canada or something, there are probably 10,000 or 100,000 people that have been harmed, and that it's just that we go in and report it to our doctors, that the paperwork from Health Canada, if you experience any of these symptoms, report it to your doctors. It's like, that's absolutely useless, because your doctor will say, just every doctor says the same thing. It's like, oh, well, these adverse reactions are incredibly rare, as if that means it can't possibly be happening to you. But the truth is, it's happening to millions and millions and millions and millions of people globally every year. And these people, 99.999% of them, are either not aware and not connecting it to the drugs at all, because, who thinks, I wonder if this antibiotic I took 9 months ago caused my tendon to rupture this week, or problems like that. The delayed reactions. Between the delayed reactions and the denial from the medical community, just the reporting is fast, unbelievable. And so we explained that, after 6 or 7 minutes of talking to the aide, the health critic for the NDP came in, France Salinas, and she was really open and listened to what we had to say, and said she would try and help us. We addressed several basic issues. One was funding for research into a variety of things like metadata analysis into comparing, let's see how many people who took fluoroquinolones are now on disability or have had different types of surgeries and so on, so we can crunch the numbers and find out. And then also research more like actual science research, where we can come up with a protocol on how to treat people. We also said we basically need an honest diagnosis of fluoroquinolone toxicity. We've got to stop sending people to one specialist after another for each and every body part in the system. Most of us see an average of 15 to 20 specialists, some 30, some 40, and none of those specialists are talking, and none of them are acknowledging the possibility that a fluoroquinolone that must have left your system by now could have possibly caused this. So the denial from the medical community, we need to address that and make physicians aware that this is actually happening, and give them a diagnosis of fluoroquinolone toxicity, or FQAD, so that the patients are not facing this wall of denial, and so the system is not spending exorbitant amounts of money on medical care that isn't helping, and in fact is making things worse. We pointed out that most of us are the people who don't process medicines, so it's not just a random thing with this one medication, but rather that when we are given more medications for these conditions we don't have, we end up having additional adverse reactions to them and getting sicker instead of healthier. And above and beyond that, we're being labeled with all kinds of conditions we don't have, and skewing the data for those people. So the people who actually have those conditions, we take the medication that might actually be helpful for them, because not all medications are bad. They're being misprescribed, and the negative aspects are denied and ignored. And so, we said, fluoroquinolones, we don't want them banned. We just want them restricted to hospital-only situations where, first of all, they're not taking them unless they really, really need them. And then when they're taking them according to a protocol that doesn't do like my doctor did, double the dose, triple the duration, and mix them with a bunch of other drugs that cause toxic reactions. So research into establishing these protocols, and then also just basically overall awareness. She said she would try and discuss the issue with other ministers and other politicians in the system here, and then also with her cohorts in different levels and branches and other levels of government. So, I feel it was a very, very successful meeting, and I look forward to more. Yeah, basically, they said, you can come back and we'll. Once on the way out, she met with us for 27 of the 30 minutes, and then jumped off and raced to her next meeting. And we stood and talked to the aide for another 10 minutes, and he said that he would, stay. I've been in contact with him by email since last year, and he said he would hook us up with the federal level people that do the same things as here, and with some other politicians to meet with them and to tell the story. So yeah, it was hugely successful.
Nice girl. Nice.
Thanks.
Very good. Okay, let's just quickly.
What's that?
I still have less than 10. I like to do 10 minutes.
Yeah, like the NDP, federal NDP health critic, and so on and so, and different,
Then you have to,
and also with the minister of health.
Yeah, because I'm doing it through my iPhone too.
That person all the
right?
time.
Nice.